We've heard a lot about the pyramid of evidence, and the evidence is part of it. We also need to look at the other components, which are the clinician's expertise, in this case, myself as a dietitian, but also the priorities, the wishes, the desires of the individual who are inviting to eat this food, and how these match together. Because if the person doesn't want to eat this food, they won't eat it, and that's possibly where some of the messages about the roles of sweeteners can come in. And as a dietitian, I should be objective and working with the evidence to fit that person's need, not my priorities. And we'll go through this. Before I go on to sweeteners, we need to look at diabetes and nutrition. This is a headache, really, if you actually look at the evidence. There are so many different ways someone, particularly with type 2 diabetes, could manage their condition with diet. There's lots of mixed messages out in the media. There's so many different studies. And again, we've got so many. If I see another meta-analysis about low carbohydrate diets in type 2 diabetes, because as we said earlier, it's the junk in, junk out approach if you're not careful. So from the guidelines, I was involved in the Diabetes UK ones. Moderate. Again, we probably need to reclaim the word moderate because that gets a lot of criticism because it's not highs or lows. It's probably somewhere in the middle. It seems to be better. And also, and again, a day like this can't help but to slightly go to this because we're talking about sweeteners. We're talking about individual components, not foods and how people eat and eat with other people. And we can detach from that if we're not careful. And again, if you're advising someone to eat, you want them to be able to follow a pattern for a long time and enjoy it. And that's the thing we can forget as well. And again, carbohydrate, you can put sugars in there, you can put a whole host of words in there that are single nutrients. Is it the overall diet that actually matters and how these things fit together? And we've had some suggestions about that around the beverages versus the solid foods, and we need to think about that. On my declarations of interest, I've done work with industry. My PhD was looking at chocolate, but I don't actually think chocolate's good for people. I think there's a lot of emphasis played on the role of industry, and we need to be strong and be impartial in that. Also, philosophical version, I'm a vegetarian, but I'm also a libertarian, so I think people should enjoy the food they eat. I've actually, although I'm vegetarian, I've fed our lovely, wonderful host today, in the past, a big ball of turkey meat. We can ask him about that later. So I'm going to look at Diabetes UK from the overall sort of recommendation for type 2 diabetes. Their statement on the use of artificial sweeteners is currently being revised as the 2018 guidelines were written. The BDA, the British Dietetic Association ones as well. And I've got a couple of case studies because I thought, well, we've been talking about a lot about research. Let's try and think how that might mean for a person. So I've got two people. I've got David, someone with type 2 diabetes, and Amy is someone with type 1 diabetes. As has been alluded before, we've talked about the soft drinks industry levy, also known as the sugar tax. I'll use its proper name. And are there unintended consequences that someone as a dietitian might think about? There are different conditions. And then some of the other things about teeth health and sort of aspartame and other things and phenylketonuria, we just probably need to mention. We've had this covered, and I've just got one slide on this, is they're safe. That's been shown, demonstrated, and we've been told that more than once today, and the evidence is there. But there's a public perception issue. And as a dietitian or sort of working with individuals, a lot of it is about that. But also, other health professions are confused. They might not read the literature. They might not come to meetings like this. They might happen to read the Daily Mail. So the message they get might not be from the original source. And we're reassessing them. We may have issues around the future in the UK about our food supply. We're not going to talk about that either. It's a nice day today. The weather's okay. We'll move on from that one. And we need, as health professionals, and encourage non-specialists in nutrition who are health professionals, seeing people with diabetes and other people around diet, to be dispassionate. Too often, nutritional messages are passed from one person to another based on their worldview, based on their values about food. So we have and quite often the people passing those messages are of a privilege. They generally have qualified professional jobs with reasonable incomes that can afford to go to nice restaurants like some of us went to last night. And quite often the people advising on food are not that fortunate. They may be going to food banks, and so we need to actually think about who we're talking to. So I spent time in another country, and it's hard to believe this levy only came in this April. because the soft drink market in the UK has shifted so rapidly before that. And we forget that it's only this April it came in. It's really quite a complicated law. Has anyone actually read the full law? And the statutes and all the bits and pieces in there. It's really quite fun. It's really complicated, like how much dairy has to be in there to be exempt, and if you're a packager that above a certain number of bottles, it's really quite complicated. I actually took the time to read it. I wouldn't recommend it unless you need sleep. Or you're in the business, of course. But I think the key take-home message is it's encouraging reformulation, but we need to then monitor what the impacts of that's going to be longer term. We don't know. It's certainly not raising a lot of money, but it's going to likely to change intakes. But if you actually look at the data, people are consuming less sugar anyway, and that was already on a downward trend. So we need people to be aware of the role, the functions of sugar and sweeteners in food. And I think that's another thing that's not widely accepted in a lot of health professionals, that sugar sometimes has a physical role in food, and you can't automatically replace it like for like with all sweeteners. And again, so that's the knowledge of food and food production and helping people enjoy food. If we're looking at type 2 diabetes, I think we can agree with that. When replacing sugars with sweeteners can be helpful. It's not a magic bullet. We can't just take that out and just have a load of it. We need to think about how it fits into a whole dietary pattern. So that's why it should be tailored, individualised. Because some people might like to retain that sweetness within their diet, and that shouldn't be stigmatised. Again, if you're working with people with diabetes, the message around sweetness cannot be sinful, and that's not helpful. So this is a way of moving around that problem. Other people may actually prefer to go for an abstinence model. They find it easier to be stricter and move away from sweetness, and some of those people in a well-managed way might even prefer to go on quite low carbohydrate diets. And we have data for those for a year or beyond. We don't again, these statements are very sort of, there's not enough evidence to say this or that, but we don't think it increases risk, which has gone on before, and sort of there's no evidence at the moment, but we probably need better design studies. And similarly with cardiovascular disease, it seems to be fairly neutral, but we probably need to watch it as our dietary intake changes, and particularly from other sources. Because, okay, we've got good data, or we've got data at the moment, that data could be improved in terms of quality, but as dietary patterns change, we need to keep watching that, which is good news for those of us researchers, because it keeps you in business. But also it's needed for humanity. In terms of weight reduction, it's removing all sweet foods actually can take a lot of joy out of the diet for some people. Not everybody. So it's not a pragmatic solution to do it for everybody. And finding alternatives can be good, but then you need to look at the quality of diet. And if you're looking at introducing snacking, you probably need to be careful, because snacking for some people might not be a best strategy for a long-term dietary change. Changing the drinks is pretty useful, and I'll take that for sort of people with diabetes, people with type 1 diabetes who are treated with insulin. Using diet soft drinks may give them an option to just drinking water, because not everyone wants to drink water all the time, and them not need to think about insulin doses. So it's got a place. We need to think about this overall pattern of eating, not just replacement. That's where sort of this individual assessment comes in, and actually working with people with their wants, desires, their goals, their clinical aims as well, where that fits. So it needs to be a full assessment. Because in the long term, we probably should encourage people to go to water, but not everyone wants to do that. And if you're looking at a lifetime, a long-term change with a dietary change, telling someone, I'm sorry, you've been diagnosed with diabetes, you need to drink water for the next 40 years, is not a palatable message in many ways. Bad jokes. So I think the key thing is how we use these, and how we use sweetness in that, and how we value it, and how we enjoy enjoyment. We forget enjoyment of food. So I get into a lot of debates about the idea, is food medicine? I go, no, food is nourishment. It can have health benefits, but it's also how we feel about food and how we engage with food with other people. So it's beyond that. And I think, the role of sweetness for some people has that thing. I think sweetness is part of the toolbox. I think it's a really good part of the toolbox, along with many other aspects of the diet. So it's a stepping stone to reduce sugar intake and improve diet quality. You don't want to just reduce the sugar, you want to get a better dietary pattern as well. We need health professionals, and particularly dietitians, to support people, and dietitians to support other health professionals in understanding how foods and food patterns can be changed and improved in an enjoyable way. Keep using the word enjoyment because I think we don't use it enough when we talk about diets. And so we need accurate information. And this is a sort of and it needs to be impartial about all food ingredients and how food comes together. We need to talk about food more with people. Because, low fat, low carb, it's not helpful. We need to talk about what that means in terms of food and what food is acceptable for people, both financially, in terms of palatability, and sort of also culturally, as well as looking at their health goals. So I'm going to look at a couple of case studies now. I'm going to start off with David. David is 47. He's classified obese. He was diagnosed with type 2 diabetes this year. It's completely fictitious. I'm using this as an example. It's an amalgamation of several patients I've seen in the past. So this is his routine before his diagnosis. So he'd have tea or coffee this morning, through the day, in the morning, evening, 4 mugs a day, and have 2 sugars in each one. Then he sort of, a few times a week, he'll have a bottle of regular cola. And then things like fruit yogurts. He'll have his beer, and then sort of his partner cooks at home. He has cooked breakfast once a week. Eats that. So it's a fairly sort of standard, simple pattern. Right. This is to see if you're still awake, because this was questioned. Can you see anything where the sugar doesn't quite add up and wonder why? Because if you actually look through the sugar, where it is actually in the yoghurt. Because the yoghurt will have the milk in there and not the free sugar. Free sugar is sort of the classification of that. So if we're looking at that in terms of not wanting to make any changes, this is without counselling, looking at the different options around meals and things like that. This is just looking blanketly across there. There's quite a lot of added sugar in there in terms of teaspoons. I like the way this morning you define your teaspoon as 4 grams a day. Yeah. We get into this 4 or 5 gram things. I've just done 4 grams there. So we've got an average sort of 17 teaspoons of free sugar a day, which is 270 calories. And if we just change that in some way, that's going to facilitate some weight loss. I'm not going to quantify it because obviously those equations are all debatable now, and sort of the amount of fat. We're not going to go into that, but it's going to make a change, make a significant change. You could make more drastic changes to that diet if you wanted. Would you want to cut out all that beer? Possibly not popular. So what could you do? Probably the simpler one would be going for the tea and coffee without sugar. You could give an option of moving to sweeteners. You could do a moderation, you could reduce the amount. You could move to sugar-free soft drinks or water. Again, give that option. So it's about negotiating change. It's co-creation of advice. The yogurts, again, you could move to low sugar, low fat yogurts because you don't want to actually go for a much bigger yogurt that may be lower in sweetness because the total energy from that can be bigger, so we need to be careful. Some people go for the low carb beers to get the sugar out. They can have more alcohol on there, so you've got to think about so probably less beer. I'm not convinced he wants to cut out his beer yet. But then again, you look at things like portion sizes, takeaway, and you give other advice. So you're looking at the whole diet quality there. And you want these don't want to short-term change his diet too much, because quite often when you've got someone diagnosed with type 2 diabetes, they can be happy to change in the short term, but then after 3 to 6 months, when they realise nothing nasty's happened, they change back again. So you want to look at gradual changes that they can still enjoy food and maintain them for the long term. You also look at options like sort of the remission type programs through direct as well. But again, at diagnosis, you might not want to go into that sort of stage. There are other options there. So this is just one of them. So we've got a potential stepping stone here. It's not a perfect solution. On its own, it will not work. You need to actually look at the diet. If you're taking the sugar out of his tea, and I've got a picture in the moment, and you're replacing it with another source of energy, it's not going to help with the diabetes management or the weight management, because primarily type 2 diabetes, in this case, weight management should be the primary goal. But the use of sweeteners should be an individual decision. It should be David's decision, based on the evidence. It's not our decision, because we don't have the right to do that. And sort of looking at other ways to reduce energy and sugar intake to help weight loss, in the context of a general healthy diet pattern that he can enjoy. It's an important thing to remember. So if we're looking at it, you've got some of these things about diet products and diet quality, and are we wanting to look at sort of a more, again, this is when you start going to that food values thing about having less refined food and sort of organic. I'm not going to go into that, but we need to look at the diet as a whole. Having plenty, basing on vegetables, so some whole grains, depending on appetite and preferences, the fat choices, the meat choice. It needs to be looked at as a package, not one thing in isolation. There is a point of caution, because some people start snacking. And I've seen it with type 2 diabetes where they start taking medication. They say, oh, start taking metformin when you take your cholesterol tablet. And they take the cholesterol tablet last thing at night, and they never had supper before. So they start having an extra meal, and that means extra energy. Or they might think, oh, I've got diabetes, I need to snack. It can have an effect on appetite and that, but again, snacks, a low sugar snack that's not necessary is still not necessary. It's actually getting a dietary pattern that works, and maybe moving foods from the meal to in between the meal if they're struggling. So moving the fruit that may have to have the lunch to a little bit later on. I used to sort of train in Leicester, and I used to see people who have Gujarati origin, and they used to say, what do you have for breakfast? Oh, I always have Weetabix because it's good for me. And you go, what did you have before before you? Oh, I used to have some dal with a chapati left over. What do you do with that now? Oh, I eat it in the evening now. So they're eating extra food in the evening, then putting a breakfast cereal in, rather than just spreading the food out through the day and looking at portion size. So snacking, just be careful. And I think this is sort of an exaggeration, that if you're taking the sugar out of the tea, then adding a biscuit, you're not doing anyone any favours. So you're actually looking at not just the change, you're looking at the consequence. It's the substitution. You need to look at what comes in, not just what goes out. So this is another one. This is based partly on sort of when I sort of did a session about the dietary guidelines up in Yorkshire, and one of the consultants mentioned one of these problems. So this is a 27-year-old, had type 1 diabetes from childhood, so 21 years. Regular hypos, recently lost the driving. For those of you not in the UK, there's a really cruel bit of legislation that if you have a hypoglycemic episode and you crash your car, and the police tend to take your meter off you, and you're classified as driving under the influence of drugs, which is a real horrible way of describing it. It's an unfortunate incident. So this is a sort of an exaggeration, sort of a slightly sort of modified version. So she goes to a clinic, she regularly checks her levels, probably not enough because, pricking your fingers are a pain, and, where she is, she hasn't got that new meter yet because the CCG haven't funded it. There's those sort of political things. She counts her carbohydrate the best she can, and she normally manages a hypo with a can of soft drink. Remember, I've mentioned about reformulation. And the reformulation message has been very good, and the manufacturers and the healthcare professionals have tried to put that message out there, and they've done a great job. And normally she does that. This May, she was feeling low, she did the right thing, she pulled in, she was feeling low, not fully aware of what she was doing, and just grabbed the popular energy drink and went off. She waited 45 minutes, as the guidance says, and she crashed. And that led to this. So this is a slightly modified case study. And as I say, I don't know if that's clear, but this is an example of one of the popular energy drinks in the UK. They did a great job telling all health professionals, as dietitians, diabetes nurses, medics, and this was shared around diabetes online communities. The company did a brilliant job. I need to be clear on that. The problem is when you're hypo, you don't tend to remember this stuff. So it's a challenge to do that. And instead of having, so it's 90 mils, you have to have twice that amount now. And Amy has been told so many times from childhood that if she drinks a whole bottle of this, she'll go crashing high, and she feels rubbish for the rest of the day. So she's very cautious when she treats it. So it is a difficult one. The industry has done the right thing. It's the big public health message of changing the legislation about sugar. That's all the right thing, but there are unintended consequences. We need to look how we can support this. So how can we do this? There are several cases. We need to probably move people onto different treatments for hypoglycemia. That's probably the easiest option. Go for the jelly babies or go for specialist glucose shots type things. We also need to think about sort of many dietitians working with inborn errors. They say there's less options for drinks. And again, these are children. I know that we don't recommend, but we've got to think of what options are there. So for Amy, we need to think of, there's a positive. There's more drinks she can drink that she doesn't need to take insulin for and enjoy that sweet flavour. But we need to look at different treatments for hypos. And these things can happen even in the best communication strategies after all, particularly if in your compromised neurological state. There's a few other considerations which I'll just finish off with. There's evidence, particularly from sugar alcohols, about dental health. We've already mentioned if you have too many of them, they can have other side effects. And they may have carcinogenic effects. But remember, some soft drinks are acidic. So There are messages that sort of, okay, we've moved away from sugar, but there may be some other things we need to think about from a health point of view. So, in terms of practical messages, we've got the BDA statement there, which we've got a link to. It's important that we enjoy food. I'm going to keep saying it's important we enjoy food because we don't talk about enjoying food to be healthy enough. It's part of humanity, enjoying food. We need, sweetness can be used in a way to reduce sugar, but include sweetness if that's what you want and that's what you enjoy. It's a good idea if you're using sort of these products to actually choose foods that are, and not sort of high in energy, because and that's where some of the solid food sort of research could be useful to help guide that. And we also need to think about how we eat, who we eat with, and that whole food approach, which I think we're in risk of losing track of because we tend to be in a rush and sort of grabbing food. And sort of extra energy from a snack, even if it happens to be lower sugar, is a snack that may not help long term. And if we're not eating it in a way to enjoy it, is that real? And it's a complicated behavioural aspect. And looking to make more deliberate choices and awareness. I'm not trying to not use the word mindful, because I'm not sure that mindfulness is always a helpful concept, but being more aware and more conscious about deliberate food choices so we enjoy them and share them, because that's part of what we are as humans. So thank you for listening.